What is expected of me at the planning station for my UK NMC OSCE exam? All that you are going to do is to identify the patient's complaints, and then you prioritize 2 of those complaints. And you write your nursing care plan informing the assessor how the interventions you've listed will help to resolve the patient's complaints. But the question is, where do I get the complaints? You need to be observant. One is the patient scenario that will be given to you for that particular station. When you skim through that scenario, you are going to identify some complaints. The other way to identify patient complaints is to be observant during the assessment station. Patients will be giving you some hints, informing you what their current complaints are. So if you are vigilant and you're observant, you will be able to identify patient complaints right from the assessment station. Don't forget that out of all the complaints that you will identify, you need to only prioritize 2. Now, here are the red flags you need to pay attention to. 1 is to identify a problem that should not be a priority, but you prioritize that problem over a more pressing need. For example, if patient is complaining of pain and has got a wound around the lower extremity and it's also having difficulty breathing, you need to know that difficulty breathing and then pain should be the priority. You do not have to prioritize the wound over these 2 complaints or problems. So ensure that the problem you've identified are the most relevant. The next red flag you need to pay attention to is to ensure that the interventions that you are writing is related to the patient's care setting. So if patient is in the community setting, you need to ensure that the interventions you write should relate to a community or a home setting. Same as if patient is in the hospital, you need to ensure that the interventions you are writing is related to a patient who is in the hospital. The last red flag that may prevent you from passing this particular station is to forget to write your name, dates, and then signature on the documents that you have been given to write your nursing interventions. Don't forget to leave some few likes, share to a nurse who is also preparing for their OSCE exam, and see you in the next one.